Welcome to Module Tool Training on comprehensive diagnosis, treatment planning, and communicating to the patient. We're going to talk today about comprehensive diagnosis and the chunking or compartmentalization of those conditions with the goal to take complex, multidisciplinary patient conditions, put them into buckets, and then set the stage for using our problem, process, and paradise to communicate the treatment need. So when I look at comprehensive diagnosis and subsequent treatment planning, and the way that I conduct myself in the comprehensive patient exam and ReCare patient exam, I want to repeat my flow on exactly what I look for every single time I see a patient, the same step-by-step flow every single time I see a patient, so that I reinforce my filter identifying systemic and dental conditions very consistently. So I'll break that down for you, but basically a comprehensive diagnosis of a patient consists of 5 buckets of conditions. There are systemic conditions, perio conditions, occlusion conditions, aesthetic conditions, and tooth conditions. So the first is systemic conditions, consisting of the oral cancer screen, identifying airway disorder, and identifying disorders of inflammation. Periodontal conditions consist of gingivitis and periodontitis, recession, abscess, and mobility conditions. Occlusion conditions, generally speaking, consist of bite things related to ortho and also wear and some missing teeth matters. Aesthetic conditions of both the teeth and of the face. And these are a list of the different aesthetic conditions. And then I grouped tooth caries and tooth fractures into the same category of tooth health conditions. And I further subdivide those conditions as either being mild, moderate, or severe, localized, or generalized. So the objective is when you see a patient, you will evaluate the patient systematically, first screening for systemic conditions and then working your way down. So now that you understand the conditions that might affect a person, we're going to take on an exercise to train our brains to chunk or compartmentalize a diverse array of conditions. Here is a patient examination. I've listed all of the teeth in the mouth, the X-ray findings, the clinical findings, which are the things that we see when we do the exam, any specific symptoms related to that tooth, and a treatment plan. I've also listed the chief complaint that the patient came in with, as well as other clinical findings that are not easily documented in chart number 1. Your objective is to indicate what systemic conditions are present by checking off the box. And if a box is checked off, it signifies that this condition is present. So take note of the conditions that you identify. For the following section, I want for you to list out in decreasing order of health impact or urgency the condition that you've identified from above, and then a very brief description of the problem, process, and paradise for that condition. So herein lies the training on simplifying our communication with our patients. The habit is to present to the patient information about every single tooth in their mouth, which is effectively counterintuitive. It is counterintuitive not to do that. But what I am advocating for you to do is instead to present to the patient the conditions that is affecting them. So we're trying to break away from speaking to the patient about teeth, tooth numbers, showing them pictures of the x-ray, and instead we're communicating to the patient about a condition that is affecting them using the problem, process, and paradise concept to communicate that condition in an efficient and seamless way.